Good morning, good afternoon, good evening. This is Dr. Garais, BIO116L for laboratory. This is Unit 2, which deals with cardiovascular, respiratory, and GI. So this is just a quick, see if you know what's what. So this is the position that you will be in, also known as the hot seat. It's right in front of the table here. And I'm just going to point to structures, and you could pause before I give an answer. So, right off the bat, what is this vessel here? That is your superior vena cava. What is this chamber of your heart here? This area right here. That is your right atrium. What is this vessel here? That is your inferior vena cava. This vessel here, which could be colored red, and if it is red, it is oxygenated. It is the largest artery in your body, and this is your aorta. If this is your right atrium, this must be your left atrium. The left atrium connects into this vessel here, which is color blue. It may or may not be colored blue on your practical. Therefore, it is a deoxygenated vessel, and that is your pulmonary trunk. The pulmonary trunk is going to divide into a left and right pulmonary artery and vein. And of course, these smaller vessels here, those are your coronal arteries and veins. This area here, big area here, is called your base, and this is called this point here, apex. Again, the way this works is you can pause it to see if you got the correct answer. Now, let's look at the other side. So, I'm looking at the other side here, and let's make some distinctions here. There's a blood vessel here. There is a blood vessel here. There is one here, another here, one here, and another set here. Okay, so let's look at those circles. So, where is the right side of your patient? And we're now looking at the dorsal surface, the posterior surface, and the right side is, if you guessed this side, it's correct. And this is the left side. So if I ask you, where is your left pulmonary artery? And your left pulmonary artery is here. Where is your right pulmonary artery? Here. Left superior pulmonary vein. Here. Right superior pulmonary vein. Here. Right inferior pulmonary vein. Here. Left inferior pulmonary vein. Here. And what is this red? What chamber of the heart? That chamber is your left atrium. If that's your left atrium, this has to be left ventricle. Okay, let's go now. Now, that's all the parts. Can we now talk about valves? Okay, let's look at some valves. I opened it up, and you see these things. Okay? So, what area of the heart is this? What area of the heart is this, or chamber? What area of the heart is this, or chamber? What area of the heart is this, or chamber? This is, of course, an atrium. Is it left or right? This is, of course, an atrium. Is it left or right? And knowing left or right, do you know which valve is which? These have chordate tendonae. Therefore, what kind of valve is this? Okay, so those are some classic questions. Of course, this is your left atrium, left ventricle. In between your left atrium, left ventricle, this is your bicuspid, also known as your mitral valve. This is your right atrium, right ventricle, and you will notice if we move it around, there's some nerves in there. You might even see your sinoatrial nerve, sinoatrial node, and your AV node in there. And since this is right atrium, right ventricle, then this has to be the tricuspid. So those are your AV valves. Now let's look at your semilunar valves. So if I cut along this way, along your pulmonary trunk and your aorta, now here, there's a hint. It's colored. So where is your pulmonary semilunar valve? Is it here or here? Pulmonary semilunar valve is deoxygenated, if you remember your box diagram. Therefore, it is here. And your aorta or your aortic semilunar valve is here. Now, if it wasn't colored, a nice hint for your aorta is, do you see this right here? These little nubs that connect into your coronary arteries? That's how you know you're in the aorta. And a hint for your pulmonary trunk, you see how wide it is, and it's connected to your right ventricle. And I have to reiterate, knowledge of your box diagram is essential for this Anatomage checkoff. And also, you will also be seeing similar diagrams for your lab exam. Okay. Next. Now, let's fix this. Let's bring this up, make it a little bit bigger. So right off the bat, I could ask you what these structures are. This is your esophagus. This is your liver. This right underneath your liver, this pink little sac sticking out of here, is your stomach. And this little brown thing here, peeping out of the right portion of your liver, is your gallbladder. You need not know the ligaments here. They are not part of the scope of what we do. So we take this and we remove it, and we get rid of the greater omentum, and then I believe the mesentery or the mesenteric fat has already been removed. And now you can see this structure here, which is your gallbladder. This structure here, which is your stomach. This structure on the left side is definitely small intestine, specifically your jejunum, and here specifically your ileum. At the very end, you have your rectum. This area right here is this rectum, and the very, very end, you have your external and internal anal sphincters. What structure is this? That's right next to your ileum. That's your cecum. And if that's your cecum, what's this little tiny thing sticking out of your cecum? That's your appendix. Then you have what intestine is this? Again, continuation of the large intestine. It is ascending colon. This running across has to be your transverse colon. This running down has to be your descending colon. If we look, this S-shaped piece of your large intestine, also known as your colon, is your sigmoid colon. Last 10 centimeters, this straight shot or the straight tube is called your rectum. And again, at the very end, you have your anal sphincters. And this very end, that is your somatic innervation, which means it is controllable. That is your external anal sphincter. The internal anal sphincter is inside the anal canal, which is right here at the end. Okay. Now, what's another thing we can ask? Notice that I didn't ask these other structures because you can't really see them. They're underneath everything. So let's remove a whole bunch of stuff using, of course, this tool. Let me remove all this stuff here. Okay. So if I'm looking at this, I'll look behind it, and then what can I see? I removed some other stuff by accident. It's annoying. Oh yeah, there you go. Okay. All right. So, of course, if you're looking at it from the backside, how do you know what this structure is? What is this structure? It's the stomach. I know it's connected to the esophagus. So, if this is the esophagus, this is the stomach, what sphincter is right here? The lower esophageal sphincter, also known as the cardiac sphincter. This structure right here, that's intimately associated, it's not a tube, it's a big gland. Intimately associated with the stomach, right underneath it, this has to be the pancreas. And this part, this tube here, which is exiting the bottom part of the stomach, this tube right here has to be the duodenum. Okay, that's the worst I could do to you with that. And last but not least, here's some sample quiz that I did. So let's do 1, 2, 3, 4, 5, 6, 7. What is number 1? That's your epiglottis. What is number 2? That is your thyroid cartilage, also known as Adam's apple. What is number 3? That is your cricoid cartilage. All three of these structures are part of what organ system or what organ set? And that is your larynx, also known as your voice box. So number 1, epiglottis. Number 2, thyroid cartilage. Number 3, your cricoid. This, of course, is your trachea. So number 4 is called the bifurcation. What is another name for number 4? That is called your carina or bifurcation. Number 6, when I'm looking at it totally, is that right or left main stem bronchus or right or left terminal bronchus? Not terminal, primary. Number 6 is, of course, left, because if I'm looking at this, well, it goes, this one has 3 lobes, and the other one has 2 lobes. You can't see the cardiac notch because we took it all out. And number 7, of course, bronchioles, but, you know, not really responsible for 7. Know the difference between left and right, and that is your respiratory. So we went over cardiac, respiratory, and GI. I hope this kind of helps a little bit, where you can kind of quiz yourself. All right? The test for this, Anatomage checkoff, you'll have opportunity after class on Thursday, but the official checkoffs start this Friday, 8 a.m. All right? See everybody tomorrow for exam 2. Good luck.